Hey everyone, this is Dr. Tran. This week we're going to learn how to save your hair, and insights are from the book How Not to Age by Dr. Michael Greger. So, graying, what is graying? So, there's a hormone called melanin, and this helps your hair have color. And it's produced by cells in your body called melanocytes. But as we age, these melanocytes gradually die and they don't produce as much melanin, which colors our hair. And 90% of hair loss is actually genetic. So the time for which we start graying and the amount of graying, the frequency, how quick we gray is really very genetic. But there are some things that also lead to graying, and that is usually what we call oxidative stress. So, free radicals that are generated definitely affect the health of our hair color, and oxidative stress comes from UV radiation, alcohol use, smoking, low physical activity, and some studies also suggest obesity plays a role. There are some reversible causes. So, chronic stress may accelerate graying. So, people who have a lot going on in their lives, divorce, for example, or losing a job, losing a loved one definitely affects graying frequency and the timing for which it starts. Smoking is heavily linked to premature graying. So, cutting back on smoking will definitely help. Surprisingly, certain vitamins and minerals can impact hair pigmentation. So, deficiencies in vitamin B6, B12, and vitamin D can definitely affect things. So, vitamin Bs are very easily supplemented, but studies have shown that unless you truly have a deficiency, supplementing will not help, partially because vitamin Bs are excreted through the urine. So, if you take in too much of it without a deficiency, you will just pee it out, and therefore it will less likely be helpful. It will just be expensive urine. And then medical conditions that are frequently associated with hair loss include hypo or hyperthyroidism. Hypothyroidism is caused or actually causes one third of all women hair loss. So if you're losing hair, it would be worthwhile to make a trip to your doctor's office to get your vitamins checked, your thyroid checked, just to make sure there isn't something we can do about it. Pernicious anemia, or any anemia really can cause hair loss as well. So that would be something that can be checked. Hormonal imbalances, especially women going through menopause, you'll see some hair loss. Vitiligo, that is more your body creating the hair loss itself. Oral contraceptives can also cause hair loss. Crash dieting, so if you're switching diets really quickly, can also cause hair loss. Anorexia, bulimia are conditions that lead to hair loss. Recent childbirth or recent surgeries can also lead to hair loss. So, just there are different patterns of hair loss that you can talk to your doctor and they can help you discern what the cause is. As far as balding goes, there's men balding and women balding, and a lot of it is hereditary, but also hormonal influences. Dihydrotestosterone contributes to hair follicle miniaturization, and that definitely can lead to hair loss. So, men who take extra testosterone may see losing hair as a side effect. Um, Stress and nutritional deficiencies weaken hair follicles. So, a lot of countries with malnourished women after childbirth will have a lot more hair balding compared to countries where um, you can drink milk and have more nutrient affluent abilities. As far as a condition called telogen effluvium. I would like to bring some attention to that. That is caused from stress, so temporary shedding due to stress or illness. And we see this a lot in patients who've delivered a baby, people who have gone through some chemotherapy, or patients with radiation or some sort of illness, some sort of surgery that can lead to this. One way to tell if you have telogen effluvium type hair loss is you don't wash your hair for 24 hours, you grasp around 50 hairs, and then you pull. If more than 5 hairs come out and you see the roots come out with it, you may be experiencing telogen effluvium. And this is a condition for which you can rest assured a lot of times after 6 months, plus the hair will grow out back on its own. So long as you help the hair grow out by improving your physical activity, hydration, and diet as well. But there are some significant psychological and physical consequences to balding that we definitely want to talk about. So, confidence is one of the main psychological impacts. It does affect mental health, leading to possibly depression or anxiety. And physical consequences increase sun exposure risk. A lot of patients end up having more cancers of the scalp as a result of no protection from hair. And then, like we talked about, some modifiable risk factors include diet, stress management, smoking cessation, and hormonal balance, which we'll talk a little bit more in a little bit. And then drug treatment for hair loss. So there are two main FDA-approved medications for hair loss. Minoxidil, which is something you can purchase from over the counter. It also comes by the name of Rogaine. And then finasteride, which is prescription only. So finasteride works by inhibiting type 2,5 alpha reductase, um, which is an enzyme that converts testosterone to dihydrotestosterone, which is DHT. So, by blocking this conversion, finasteride significantly reduces the serum and scalp DHT concentrations, which help to prevent the miniaturization of hair follicles and promotes hair regrowth in men with androgenic alopecia. Um, so, long story short, is this medicine can definitely help, but it needs to be used in the right population of patients. So, finasteride is a medication that we also use in men with benign prostate hypertrophy. It also lowers blood pressure. So we have to make sure that the patient has a blood pressure that can tolerate such a medication. Certainly, dosages can be adjusted and titrated to effectiveness. So just be in touch with your doctor, and we can definitely help you decide if this medicine is right for you. And then other treatment for hair loss, so surgical hair transplants, we hear a lot about this. 85% of grafted hair do tend to survive, but it may be quite costly. So it's something that is possible, but sometimes there are complications like scalp necrosis, scarring, pain. Um, Platelet-rich plasma is something that some places use, but for the studies, there's not enough evidence to suggest this as the main treatment so far for treating hair loss. Lasers can help, but there are little clinical significance in studies, and Botox surprisingly actually causes hair loss when used a lot on the scalp. So there are some supplements that can be used, but all the studies do suggest that unless you actually have a deficiency, the supplements will probably not help. So checking for the deficiencies would be important. So checking your vitamin B12, checking your vitamin D, and making sure that you don't have a thyroid disorder would be what I would suggest, and checking for anemia as well. So, biotin, vitamin A and vitamin E, we actually hear so much about because there's a $3 billion industry for hair loss treatment. However, it doesn't have a lot of support in that it truly helps with hair regrowth, surprisingly. And that was very surprising to me as well. Biotin actually interacts with a lot of things in your body, and I have even seen it cause abnormal thyroid hormone levels in patients. And once we stopped the biotin, the hormone levels went back to normal. And as we know, thyroid hormones play a key role in hair regrowth. And then vitamin E and vitamin A also can accumulate in the liver. It's one of the so vitamins A, D, E, and K accumulate in the liver and do not excrete through the urine. Therefore, if you take too much of it, it can actually lead to liver toxicity. Um, and then some things that do help. So, a study did find that drinking soy milk just once a week will lead to 62% less hair loss. Pumpkin seed oil worked. It compared to minoxidil, which is Rogaine. Pumpkin seed oil was not as effective, but it was 5 times less expensive. So it's something that you could consider using. Um, Ginger does not work. So, it actually suppressed hair regrowth, which was surprising to me because I see so many videos about how rubbing ginger on your scalp will be helpful, but that is not helpful indeed. As far as rosemary oil, that works very well. And we usually say that you just take a teaspoon of your favorite lotion. Hopefully, it's a lotion that doesn't cause any hair problems for you, and then you drop in 10 drops of rosemary oil that's extracted, so extract, and then you just apply it to your scalp twice a day. And that we see that that is as effective as minoxidil and much, much less expensive. So, in summary, our challenge to you for this month is perhaps drink some soy milk once a week. Get blood tested if you're losing hair suddenly. We want to check for your thyroid, check for anemia, check for vitamin D, vitamin B deficiencies. You can do the hair pull test yourself. Just grasp 50 hairs and pull. And if more than 5 hairs come out with the roots, then that may suggest a hair problem. And then consider medications like minoxidil over the counter or finasteride prescription. Living well, staying hydrated, exercising, avoiding stress helps, and then rub on some rosemary oil to the scalp. Well, that's it, folks. Thank you for listening, and we'll be back in touch next month. Have a blessed day.